Good evening and welcome you all to the EIZOC webinar Voice of the East. Today's theme is Cornea Revisited. I welcome you on behalf of the whole. Now, to begin the opening ceremony, I will like to request the President of EIZOC, Dr. Abhijit Ghosh, to give his welcome address.
Thank you, Sujat. Thank you so much. Always a wonderful to be and wonderful. It is our honor to have Dr. Rajesh Sinha with us today.
Dr. Rajesh, a wonderful paper, and I learned a lot of things. Suppose if you suspect the case of keratoconus, that is number one.
By suspicious case, you mean to say that there is.
Thank you, Professor Rajesh, for a fantastic talk. And it is a wonderful webinar, and I think without...
Gupta will be moderating Dr. Ravi Daulat and Dr. Aki. Dr. BP Kashyap will be moderating Dr. Praveen Subudhi and Dr. Janata Medhi. And Dr. Sunil Kumar will be moderating Nidhi Kashyap and Dr. John Sarkar. After that, there will be a panel discussion which will Bharti Kashyap, a prolific LASIK surgeon from Kashyap Eye Hospital, Jharkhand, and Dr. Sudhir Kumar from NMCH.
So let me introduce you to Dr. Praveen Subudhi. Young, handsome guy, very nice, fantastic. Tell us.
A very nice presentation, Dr. Subudhi. Had it been presented to me, I would, instead of doing early intervention, I would have kept the patient for follow-up at least 6 to 8 months, and every 3 months I would have done the follow-up with refraction and topo. And suppose everything is stable, then I would have continued the patient's. First, I would have given him RGP contact lens for immediate visual improvement. And then, after repeated follow-up, if I would find that everything is stable, I would have given him solution of RGP contact lens, either continue with it or go for the phakic lens. And if it is progressive, and I find that it is progressing, then I would have done CXL, and then again I would have followed this patient for stability. And if the patient is stable, then again phakic IOL. It is very good choice for patients. And one more thing, CXL. When you do CXL, such small cylinder, 1 and 1.5 cylinder is taken care of. You don't need to do anything on the cornea.
Yeah.
And another thing,
in this case, I did not go for any refractive correction. Just a
I know. You did just topo regularization.
Yeah.
So, and the other thing is that before prevention part, when we take up LASIK cases, 4 things to prevent ectasia is a must. If we have a corvis, then we have to see the corneal biomechanics and topo guided biomechanics. Second, superior and inferior epithelium matching. Third, higher order aberrations by eye trace and coma, etc. And the fourth is family history and rubbing. These things are very important. How many of us assess vitamin D level before the surgery? Because that is also important to see the vitamin D level before the surgery. So I don't know how many of you are doing it. I am doing it.
And he has said so many things he is doing. He has enumerated all those things. Very nice. So can you proceed to the next speaker?
So our next speaker is very young, dynamic girl from the Ranchi, Jharkhand, Dr. Nidhi Kashyap. She has done the MS Ophthalmology, DNB, MNAMS, FIST. So today she will be speaking on the DSEC, that is the Descemet stripping endothelial. Over to you, Dr. Nidhi.
Thank you, EIZOC, for giving me this opportunity. To start off with the preoperative experience.
I have a question, Dr. Nidhi. Like, if there is a case of post-operative.
Yeah, Dr. Nidhi, I have one question. If the patient with PBK had the AC IOL, so do you always go with the IOL exchange, or we can go with the AC IOL in certain patients?
So if the IOL is stable and it has been a long-standing IOL which is there in the eye,